give y'all a negative, idea about that. I'm not going to GNC or Walmart or CVS or any of those places and grabbing a detox box off the shelf. Those are full of a bunch of man-made chemicals and synthetic vitamins that just cause more toxicity to our body, to our liver, and our gut. And that's the opposite of what we're trying to do. So if you guys have ever tried that with no success, don't worry, we're not doing that. And I'll explain a little more about how we do that and how we help people naturally detox. Fact of the matter is, our body is always trying to detox at all times. We just put too much junk in it and bog it down every day with medications, drugs, alcohol, and especially the poor food that we eat. So it's really about focusing more on healthy food that our body was designed to use and break down naturally. So, all right. And again, I'm Dr. Jones. I'm the clinical director at Tyler Wellness Center, and our office, we just moved about a month ago. We're located South Tyler, right behind Slim Chickens. Is everybody kind of familiar with that area? So behind Slim Chickens, it's a nice new office buildings back there, and that's where we are. So, okay, let's dig in. So today I'll be discussing how we get the results that we do. The key is you must have a systematic approach. That is the key. Almost. Okay. So you must have a systematic approach. And if this makes sense to y'all, you'll be able to move forward at the end of the day. But if not, hopefully you'll get a little more information and learn a little bit, become a little more educated in what we do and how you can help yourself. And you also get a nice little brunch along the way. So whether you came here today for stubborn weight loss, or maybe it's high blood sugar, or poor blood labs, maybe it's hormone imbalances, thyroid problems, brain fog, maybe you just don't feel well, maybe you just know that you should feel better. Whatever it is, you'll begin to understand why our health system, our current health system, is failing us and what we can do to make it work better for us. I would also like to identify a little bit about who I am. And I just want to say that first off, I'm not the one that heals you. I don't treat or cure any diseases. And that may not be what you wanted to hear right off the bat, but hang with me, stick with me, and I think you'll understand more as I go along today. And that's not to say that our patients that come to our clinic don't get the results that they came for. They absolutely do. Do they lose weight? Yes, they do. Do they get their diabetes turned around? Certainly do. Do they get digestive issues smoothed out and worked out? Of course, they do. And so it's just, again, following that systematic approach. I'm also not a conventional medical doctor, all right? Not an allopathic, I'm not an endocrinologist or a psychologist or a neurologist. I actually got my doctorate in chiropractic back in 2010 from Logan College of Chiropractic. And I've had quite a bit of extensive postgraduate studies in functional nutrition, functional endocrinology, and functional neurology. So, the practice that I have chosen focuses more on functional nutrition and helping people naturally turn their health around. Let's compare the current healthcare system to what we do at my office with functional nutrition. So, does anybody here know what an endocrinologist does? Kind of in general, like who they work with? Anybody? No? Go ahead. Yeah. Okay. So, most of the time, typically what an endocrinologist helps people with is diabetes, thyroid disease, hormone imbalances, and things of that nature. Okay? So they work with glands and again, the hormones. Does anybody know how you get an appointment with the endocrinologist?
General practitioner.
Exactly. So you're referred, right? And you're referred because what? Because you're sick, because there's already a problem, correct? So there's already a problem. And then once you're referred, what's the typical treatment? Does anybody know? Yeah.
Well, when I went to get blood work, they told me that I was hypercalcemia and hyperparathyroidism.
Okay.
Find out why was happening.
Yeah, so some blood work, but typically the main mode or method of treatment is medications, right? So hormone replacements or medications. My question is that acting on the underlying problem or just the end result of the problem? Okay. Is it acting on the cause or just the symptoms? Right? Exactly, just the symptoms. Are you going to correct the body's dysfunctions by doing that? You're not. Would it be better to go to the endocrinologist before the problem actually arises? I believe so, right? Would it be better to address the cause before it becomes a bigger issue? I certainly believe so. But unfortunately, that's not how it usually happens. Now, functional endocrinology, that's what I do. So looking at the problem from a functional standpoint and acting on the cause, figuring out what's causing these symptoms. Everybody has symptoms. We all have symptoms, but we have them for a reason. We don't want to just put a Band-Aid or a mask over it and cover it up and act like it's not there, okay? Typically, that's what medications do. They're not designed to fix the underlying problem. So here's an example of functional endocrinology and what we do. Let's say you have a blood sugar problem with insulin resistance to the point of diabetes. We're going to do some blood work to figure that out for sure. We're also going to make some improvements in diet, exercise, and functional nutrition, and we're going to turn it all around. And the neat thing is we're going to prove it all with blood work. So we'll make changes and then check those with proper blood work. All right? Now, will y'all be honest with me for just a second? Please raise your hand if you're taking a medication. Okay, so most of us. Do you believe that that might create some health problems? I do. Okay. Do you believe pharmaceuticals will actually resolve the underlying health problem? It's not. It's not. Do you think if we correct lifestyle, we could probably get to the bottom of this? I agree. Okay. So 85% of all medical procedures, 85% of all medical procedures and surgeries are scientifically unproven, according to the British Medical Journal. 90% of all diseases prevalent today are not treatable with orthodox medical procedures. Pretty astounding when you think about it. Now, the issue for most folks is that we're just getting the wrong information. There's so much information out there, from infomercials to Facebook posts and magazine articles. It's hard to decipher exactly what to believe and what's correct. So some of you may have tried workout programs, maybe something, hopefully not this, but maybe something like this in the past, right? So this is like an ab lounge or an ab chair, and you get this thing and you get home and you start bending your fat, right? So you keep bending. How many of these do you have to do before your fat just bends away? It doesn't work like that, right? It just doesn't work like that. So we get the wrong information or the wrong idea. If I told you the correct way to exercise, and that it only took 20 to 30 minutes, 2 to 3 times a week, does that sound doable? Okay? And that's really all it takes. The key is you have to put muscle on your body. We have to add muscle. Now, we're not trying to make a bunch of little Arnold Schwarzeneggers, but we really know the benefits, and we have to put muscle on our body. It has great effects, not only on how we feel, but how we look, and it helps naturally balance hormones as well. So great benefits. And here's the thing, 1 pound of muscle is an extra 1,500 calories burned. 1 pound of muscle is an extra 1,500 calories burned. So how does 5 extra pounds of muscle sound? I think most of us would sign up for that, right? That's an extra 7,500 calories burned. Not bad, okay? Now, again, wrong information or the wrong idea. This is not exercise, okay? This is not exercise. Again, we've gotta know and have a plan to follow as far as what the best ways of exercise are. And just to clarify a little bit, walking is great. Now this is good for the dog. Walking is fine, and I never discourage anybody from walking. In fact, some people, that's where they need to start, and that's fantastic. But what we do is, as we get people feeling better, as people start to have more energy, and as people start to have less joint pain, and they're having more motivation, what we do is we focus more on resistance training, okay? And that can be in a gym, it can be with weights, it can be with machines. We've got folks that have the bands at home, that's perfect. We even have folks that use soup cans, okay? So soup cans in the kitchen or wherever you can do it. But the key is resistance training to promote some muscle on the body, okay? Now, just real quick, what's your why? So for me, this really hits close to home, and why I'm so passionate about what I do with functional nutrition and functional endocrinology. So my father on the left was diagnosed with diabetes about 8 years ago. My mom is hypothyroid, okay? Annabelle, my daughter, in the middle, and grandma in the back. The youngest and the oldest, thankfully, are healthy as a horse, so they're good, and we're blessed with that. My wife, at the age of 17, was diagnosed hypothyroid, okay? And then later, she met me, which hopefully was a good thing. And when I was getting into this functional nutrition stuff, we started realizing that we needed to test more. Doctors typically only check the first two thyroid markers, which is TSH and T4. That's about all they'll look at. And it's really not their fault. It's actually insurance. Insurance is just dwindling down next to nothing. So the big picture, when you do blood work, we actually look at 10 thyroid markers. We can see 10 thyroid markers. So we can see really how not only the thyroid is functioning, but also the thyroid hormones that are getting converted in the body. Is that conversion taking place? That is the key. And what we found out with my wife is that she's actually autoimmune thyroid, which is Hashimoto's. So some of you may have heard of Hashimoto's disease or hypothyroid or autoimmune hypothyroidism. So that's what she was dealing with. Thankfully, we've been able to address their diet and nutrition, and they're all feeling much better. And long story short, taking less medication, which is great. So, all right. Now, the purpose of food, that which is eaten to sustain life, provide energy, and promote growth and repair of tissues. You have to start thinking about what you're putting inside your body, okay? A lot of us, especially in America, we rely on fast food. It's convenient, it's cheap, it's easy, but think about it for just a second. It's loaded with preservatives. There's people that will take a cheeseburger and fries and set it in their office, their health and wellness office, and it will stay, she's laughing, she's seen it, it will stay just the same. It won't break down, it won't mold for years. I'm not talking like a year, I'm talking years, sometimes 10 years. So we're putting food in our body that is genetically designed and chemically designed to not break down. But then we want our body to break down, and we wonder why we're having all of these health issues. So we really have to be more educated and understand what foods are good for our body and what foods are promoting inflammation. Okay? So the example I like to give is, let's take somebody that's on a 12,000 calorie diet of processed foods, just 12,000 calories, processed food, versus a person that's on a 2,000 calorie diet of whole foods, whole nutrition. Who's going to have more body fat at the end of the year? Processed food, right, exactly. So processed food is not totally about calories, okay? We've been led to believe that it's just about calories. Calories in, calories out. That's not the whole story, okay? If it's synthetic or processed food, it's junk. Synthetic or processed food. That goes for vitamins as well. All right? It might be a shocker to some people. We have a great, just extensive, vast selection of great supplements here. But if you're getting your vitamins from Walmart or Sam's because they're in huge bulk and they're discounted, or even GNC and CVS and places like that, most of that is synthetic vitamins, man-made chemical vitamins that really just promote more toxicity in our body. Okay? So it really needs to be just like our food. The vitamins and minerals that we get need to be 100% plant-based. That's really important. Okay? Now, talk a little bit about hormones. We got fat-burning hormones versus fat-storing hormones. All right, question is, do we need the fat-storing hormones? Do we need fat-storing hormones? We do. So we need them, we just need them in balance. We need them to all be in balance. And how do you know if they're balanced? I mean, yes, you have symptoms and that can kind of be an indicator, but we test for these. We test for these. Insulin, estrogen, cortisol, we test progesterone, testosterone. So the insulin and, cortisol and DHEA, that's another one. Those two are big stress hormones. So we'll talk about those in a little bit, but we look at those through the saliva, which is the most accurate way, and we can see where the imbalances are. Okay, and then we work to address those, not with hormone replacements or medications, but through natural foods and nutrition, but also high quality, 100% plant-based supplements. Okay? Moving right along. Which body type are you? We've got an estrogen-dominant body type, adrenal, thyroid, and liver. So estrogen, if you have estrogen imbalance, that's usually leading to bigger hips and breasts, and this is because of an imbalance of estrogen and testosterone. Okay? Adrenal, the adrenal presentation is a big belly and skinny bird legs, skinny weak bird legs. All right? And again, this is something where you have to get your hormones under control, especially insulin, a stress hormone. Okay? If you're a high stress person, this could be you. Thyroid, what we'll talk about a little more in just a minute, but that's just typically a general swelling or puffiness throughout the body. Okay? And then liver. Liver toxicity or liver imbalance is you're going to have a big gut typically. You're going to have a big gut, and that's called ascites. Does anybody know the two main things that are most toxic to the liver?
Alcohol?
Oh, sugar's a big one. Alcohol
Or those drinks?
and drugs. Just medications. Medications, okay? So medications, drugs, alcohol, the biggest things that really tax the liver and cause it to get backed up and toxic. Okay? Now, let's talk a little bit about the thyroid. All right? So at the top you see why your lab tests are normal, but you still have symptoms. That may be some of you in this room. You go to your primary, they run the yearly physical blood work, and again, they just see TSH and T4 typically. So 2 markers. If you remember, I said there's actually 10 total. So they see TSH and T4, and a lot of people will get a pat on the back and say that the numbers look normal. But that can be hidden due to the medication, and they're also not getting the complete story. So here's the key. You see the thyroid gland there at the throat, and you see T4 and T3 that come out of the thyroid. Now the interesting thing is that 90%, actually a little over 90% of what's made from the thyroid is T4. But guess what? That T4 hormone is inactive. So it is not able to be used by our body. What it does is it goes to different parts of our body and it gets converted into T3, which is the active form of the thyroid hormone. So the two biggest places that T4 gets converted into the active T3 are the liver and the gut. Guess where almost all of us in this room have the most toxicities and most problems? The liver and the gut, okay? So, it may not be, in fact, in a lot of people, it is not actually the thyroid that is the problem. It's the conversions that are taking place mainly in the liver and the gut, but they can't. They're not happening near as efficiently as they should because of the buildup and toxicities in the liver and the gut. So, and you don't know that when you get the yearly physical because they're not doing the full tests. Okay, they're just checking the tip of the iceberg, but again, we look at the whole story. All right. Okay. So testosterone. Something else that we look at, males and females. Okay, but I like to use this slide to explain how we as functional medicine practitioners look at blood work. Y'all may have heard of the pathological range. If you go to get your blood work done, what shows up on your blood work is the pathological range. And what that is, it's kind of sad, is a pool of all the sick people that go to the hospital. And the crazy thing is, it is different depending on what region you live in. It is a little bit different depending on what region you live in. So you're really being compared to all the other sick people. I don't think that's the best way to do it. Thankfully, people way smarter than me have figured out what we go by, and that's the functional or optimal range. Okay? So the functional or optimal range is a tighter window of markers where these organs and body systems are functioning at their peak or functioning at the optimal level. So for instance, I like to use the example, a guy just not feeling himself, and he's lost some enthusiasm, not playing golf with his buddies anymore, he's not going to the gym anymore, he's not noticing, he wasn't noticing results anyway, so he just kind of gives up on the gym, and he's just not feeling himself. So he goes to his doctor, and he has him check his testosterone. Comes back in the normal range, the pathological normal range of 200 to 800, he's at 250, so he gets a pat on the back and he says that he's normal, okay? Now, if we were to do this test, we would be looking at a tighter window. Our blood work, our testosterone, when we do it, we're looking for them to fall between 600 and 800. Okay? So if this guy were to come to us and through functional medicine and through addressing some issues, some underlying issues, if we were to get his testosterone up to 650, do you think that this guy is going to feel like a new man? He absolutely is. He absolutely is. And again, the great thing is you don't have to give them, hormone replacements. A lot of times you can help this naturally through exercise and healthy nutrition. But again, it's looking at it with functional lab ranges versus the pathological ranges, which everybody else typically looks at. Okay. Now, cortisol. Okay. Cortisol is actually a circadian rhythm hormone, meaning that it fluctuates throughout the day. As you can see, it's higher in the morning. It helps us wake up and gets us going, but then it naturally declines and slopes off to very minimal levels in the evening to help us fall asleep naturally. So, example here, somebody goes to their doctor and they do a snapshot cortisol, typically through the blood, which is not the best way, but they do a snapshot through the blood, and they happen to come back on the line there. So it's at a normal level. But if they were to do this like we do, we actually take 4 different levels throughout the day through the saliva, because the saliva gives a much more accurate reading, and we are able to chart this cortisol rhythm, the circadian rhythm, throughout the day. So this person looked normal and had a good first cortisol, but as you can see, way low the rest of the day. Okay, so this person is going to be dragging, probably a very high stress person, and their adrenals and cortisol levels are just taking them down. Okay. So here's the deal. If no one's testing and they're just throwing darts at the dartboard, who's the real guinea pig? Okay? Who's the real guinea pig? And you know, guys, I've told you what doesn't work today. I would like to start kind of explaining how we can start turning this around. All right? So we got to put the missing pieces together, right? Got to put the missing pieces together. And if y'all are taking notes, I'm going to review our 4 pillars of health right now. So we'll go over those and make sure y'all understand those, because this is the important part. Okay. So you'll see 5 things here. And I talk about 4 pillars. The nervous system, being a chiropractor, I do feel strongly that the nervous system is a very important thing. Your brain and spinal cord and nerves control literally everything in the body. But what I found in my first few years of being a chiropractor, was that if you don't start addressing these underlying causes and underlying issues with proper nutrition and lifestyle choices, you can adjust these folks to the cows come home, and you keep adjusting them and keep adjusting them, and it just doesn't fix the issue as well. But when you incorporate all these things together, you're really changing people's lives for the better. So, all right. If you want maximized health, is nutrition mandatory? It is. It is. So nutrition is number 1. All right. Nutrition is number 1. If you're eating well, but your gut and liver are backed up, can you truly get healthy? You can't, right? You have to what? Detox. Good. So detox is number 2. What about your hormones, right? If you eat right and detox, but your hormones are out of whack, can you truly get healthy? You can't. You can't. And what about exercise? Exercise is the 4th one, or fitness. Can you achieve maximum health without exercise? You can't, right? Thankfully, it only takes 20 to 30 minutes, 2 to 3 times a week to really make dramatic changes, okay? Now, how are you going to get that information? There's all different ways to get this information, right? You can read a book. You can read magazine articles and things like that. But I prefer to coach or teach people, okay? Kind of like going through school. It's an education curriculum or an education process. That's how people really learn it and live it, okay? You can read a book, and books are great. I love reading, but it's also good to have some accountability there, okay? Some accountability and motivation. So here's how I do things at my clinic. Again, I don't treat, cure, or heal anybody. You can't come into my office and just pull out your wallet or your credit card and buy your health. Unfortunately, that does not work. But what we can do is help you turn everything around and take you through our education curriculum. Okay? And if it makes sense to you and you want to move forward, but you want to leave 1 or 2 of these out, are you truly going to get to maximum health? You're not. Okay? So in the past, if you've ever tried 1 or 2 of these things, but didn't get the result you were looking for, you have to ask yourself again, did you incorporate all 4 pillars? You know, fitness, nutrition, detox, and hormones. And of course, the nervous system as well. Did you incorporate all these? And probably the most important thing, was there a solid system intact? Was there a solid system intact to follow? If my program didn't have a solid system, our patients would fail a lot more than they should. Okay? And finally, did you have an instructor? Did you have somebody to help keep you accountable? It's extremely important as well. Okay? It's tough to make these changes and just keep yourself motivated and accountable. Okay? Now, I like to give this example. Imagine going to fly a plane, right? Could you go fly a plane after just reading a book? You couldn't, right? I hope nobody would try that. Would you have to go to a class? Yeah, if you want to fly a plane, you're going to read a book, I'm sure, but you're going to have to go to a class, right? And is there going to be an instructor? And eventually that instructor is going to sit in the plane with you and y'all are going to fly that plane, right? So our practice is no different, okay? That's the philosophy, and that's the way that we think it works best. Okay, so we're no different than that. Some of what you learn is through reading, some is taught, and some is just through being mentored or coached at our clinic. Okay, it's very individualized as well. Very individualized, and it's done through testing, not guessing. All right, we rely heavily on the nutritional testing, the blood work, the saliva, and stool testing. Okay, so hopefully that sounds good to everybody. Now I've got a quote here. So a Chinese proverb: "Tell me, and I may remember. Show me, I will remember. Involve me, and I will understand." And I think that explains how we do things at our clinic very well. So, kind of a trick question based off this: what is the most important thing that I have taught you all today? Anybody want to take a shot at that? It's taking action. All right, taking action. Again, you can get all this knowledge, and you can read books, and knowledge is power, right? Knowledge is power, but not entirely. Is acting on the knowledge. That's true wisdom. Okay, that's the true wisdom. So you've learned enough today that if this approach makes sense, you'll be able to make a real important decision today. I'm going to ask you to start helping yourself. What you'll have the opportunity to do is come in for a consultation, but you have to be ready. You cannot be like this guy, all right? You cannot be like this guy. Unfortunately, these people are really difficult to help, and you can't force anything on anybody. So you have to be ready to make some changes. You have to be proactive, and almost sick and tired of where you're at. Okay. So let's put this up here. This is kind of a summary, and we'll go over this. Kind of a summary of everything that we do. So when you come in for the initial consultation, right, and you guys will have an opportunity, we'll talk about that in just a minute, but if you were to come in for an initial consultation, you're already going to have your paperwork completely filled out, all right? So we've got your email, and if you want the paperwork and you're interested in coming in, we're going to get that to you before you even step foot in our office, and you're going to have that filled out. And I promise when you're filling it out, it's kind of lengthy, but you're going to be saying, finally somebody's asking me these questions, okay? It gives me a lot of good information to help people. Then we sit down for your consultation once you come in, and we talk about your specific concerns, your problems, but we also talk about your goals as well, okay? And we'll talk about a plan of action and how long I think that'll take and what all that will involve. And I promise you, for that initial consultation, I set aside a full hour for that consultation. Not 7 to 10 minutes like a typical doctor visit, okay? So today is a little bit more of a lecture, but when you come in, it's more of a conversation, all right? And we want to get to the problem, the bottom of your issues and work to correct those, okay? What about a consult fee? You guys feel like it's fair for me to have a consult fee for that? Hopefully so, all right? So normally that fee is $237, all right, for the initial consultation, that hour appointment. But today, since y'all came in and heard the message, I'm going to discount that $200, okay? So it will actually be a $37 consult. I'll get this up here for you. So the consultation, instead of $237, is actually only $37. And why do I do that? Why do I even charge the $37, right? There's got to be a little bit of skin in the game, okay? I wish I could help everybody, but you have to be wanting to get better. And this just, again, tells me that there is a little bit of skin in the game. And plus, I do this, I want to reduce the barrier. I know y'all don't know me that well after just being here today, but I want to reduce the barrier and have another opportunity to talk to y'all and hopefully help y'all make some positive changes. Okay? Now, the thing about this consultation, let me say this. If your spouse comes and is wanting to be seen as well, it's only $17 for the other person. And that doesn't have to be a spouse. It can be a friend, a coworker, somebody from church. It could be a cousin. So if you bring anybody else that's wanting to sit down and talk about their health and see if we can figure some things out, it's only $17 for them. If there's more than one, only $17 for the rest. Okay? Now, here's the kicker. I do absolutely require the spouse to be at this first appointment, the first consultation, okay? That does not mean that the spouse has to make these changes. That doesn't mean that the spouse has to pay the $17. If they're happy with the way they feel and if they're not looking to make any changes, I just want them to be there for support, okay? So it is mandatory. If it's not the spouse, or if you're about to kick the spouse out of the house in a couple weeks, then we'll try to get a friend or family member there. But I just want to again harp on the importance of that I do like somebody there for support. Research shows you only remember about 7% after 48 hours. It's very difficult if they're not there. It's very difficult to go home and explain everything you just heard in this consultation. So you knock all that out and just have them come in, and it's usually not an issue at all. And most of the time, I mean, nearly all the time, the spouse is very glad that they came after the appointment. Okay, I'm not going to force them to do anything. I just like them to be there for support. Okay. All right. I want to recap, and then I've got a special kind of gift or offer for y'all today that I'll go over in just a minute. But I want to recap real quick. So let's get together. What happens after this? All right. You could schedule to come see us for a consultation. All right. And if you do, what will happen at that meeting? Again, at that meeting, the first consultation, we'll sit down. I do want the spouse or a good friend or family member to be there. And we're going to go over your paperwork that you already have filled out. And we're going to make sure that I understand your problems. I want to make sure that I can help you. But we're also going to make sure that it's a good fit for everybody. Okay? How long will that last? An hour. So we got an hour blocked. All right? It could take 45 minutes, it could take an hour. If it takes a little over an hour, that's fine. Should I bring anything? Yes, absolutely. When you come to this consultation, you're bringing your paperwork already filled out and a spouse or friend or a family member or somebody. Okay, where will we meet? We meet at our office, again, behind Slim Chickens. It's 7925 South Broadway. The best way to describe it is the south part of Tyler. Behind Slim Chickens, there's a Sprint store right there, kind of a newer development in the last couple of years. So then what? All right? So the three most common things that happen at our initial consultation. I just like to go over these real quick, give you guys an idea. So 3 things that can happen after our meeting. So after that initial consultation, we agree to work together to help you reach your health goals. All right? We're all friends, everybody's happy, and we agree to work together to reach your health goals. The second thing sometimes that happens is we agree to work together, but your schedule is busy and doesn't allow for that right now. So we'll set a date in the very near future. And the third thing, if it's clear that it's not a good fit, you can start throwing things at me, knock over our chairs, and just run out of the office if you want to, okay? So hopefully that won't happen. Although a couple weeks ago, I did get threatened in my office. A lady told me that she would hit me in the face if I was condescending to her. And I've never been threatened like that. It was kind of funny, and her friend was actually with her. She was like, oh my goodness. She's like, did you get to take medication today? But she said she would hit me in the face. That hasn't happened yet.
You didn't get hit?
I didn't get hit.